is Nur Zahira binti Majri, and I will explain about case summary. So our case study is about Tahir. Tahir is 45 years old, working as a vehicle spare part production operator at an automotive company in Selangor. His job is to manually install vehicle spare parts. His working condition requires him to standing and bends regularly over a long period. In 2012, as a result of strenuous work activities, he experienced back pain. He thought it was normal and considered it as temporary pain. He had informed several employees about the pain, and there were also 9 other workers experiencing the same pain. He has sought treatment at a panel clinic and further treatment at a specialized hospital. He was hospitalized for 2 weeks. As a result of magnetic resonance imaging MRI scans, he was confirmed to have a slip disc and was advised to undergo physiotherapy treatment and need to take steroid injections. For the answer for question number 1 is, under the Employees Social Security Act 1969, employees can receive free medical treatment, physical or vocational rehabilitation, and financial assistance under Act 4 Employment Injury Scheme and Invalidity Scheme, which allows Socso to provide free medical treatment, physical or vocational rehabilitation, and financial assistance if accidents or diseases have rendered them unable to work. In the event of an employee's death, his or her dependents are financially supported by pensions. According to this, Tahir can get some benefit under the Employment Injury Scheme. Tahir is eligible for free medical treatment at Socso's panel clinic, a government clinic, or a hospital until he is fully recovered. Further treatment at a government-run specialist hospital is free, and he is eligible for a second-class ward for the 2 weeks he was hospitalized. For Tahir physiotherapy treatment, Socso will cover all costs associated with the rehabilitation facilities based on agreed-upon rates, terms, and conditions. For the steroid injections, Tahir can get it for free if he takes the injection at the panel clinic or at the government hospital. That's all from me. Thank you.
Alright, my name is Nur Shazwani binti Madin, and I would like to share the answer for case study for question number 2. So there are 4 social security benefits eligible for Tahir by referring to the case which is physical or vocational rehabilitation facilities. This means employees will be eligible for free rehabilitation and vocational facilities. Physical rehabilitation such as physiotherapy, surgery, and others. Thus, vocational facilities such as training in electrical, mobile phone repair, and others. All expenses for the above rehabilitation facilities are borne by Socso in accordance with the prescribed rates and conditions. But in Tahir's situation, he needed physical rehabilitation, namely physiotherapy treatment, to recover from his illness. Okay, next, the second social security benefits is medical benefits. Socso provides protection to employees who have an accident or an occupational disease caused by their employment. Employees will be guaranteed free medical treatment. The coverage under this scheme covers the following accidents: are industrial accidents while carrying out his works, accidents while traveling, accidents during emergencies, and occupational disease. Okay, so according to this case study, Tahir is a service disease where he got the disease because of his job. So Tahir gets some benefits under the employee injury scheme. Therefore, Tahir is eligible for medical benefits at Socso panel clinics, hospitals, or to claim reimbursement for the cost of medical treatment at the Socso office. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Ashiki binti Ibrahim. I will explain the next point about social security benefit, which is temporary disability benefits. Temporary disability benefit is paid to the employee for the duration of his sick leave, certified by a doctor, and must be at least 4 days. However, temporary disability benefit will not be paid on the day on which the employee attends work and is paid salary. In Tahir's situation, he was hospitalized for 2 weeks for further treatment to recover from the back pain. So, he is eligible for disability benefit when he is diagnosed with sleep diseases. Lastly, the Social Security benefit is income replacement benefits. This principle applies when determining the amount of interest payments. This related to the amount of contributions paid based on the employee's salary. The concept is to ensure that employees do not feel financially affected if they have a disability or ability. In Tahir's situations, he was able to take 2 weeks off and his treatment take a long time to recover, so that it is caused his income to be affected. Therefore, he is eligible for income replacement.
Assalamualaikum, I'm Amir Anwar. As in the case of Tahir, he can gain benefit in the component of Employment Injury Benefit, ILO. It is stated in his medical condition that he is experiencing a sleep disk due to his working environment condition that requires him to be standing and bend regularly over a long period. As a result, he had been advised for a treatment at Panel Clinic and further treatment at a specialist hospital. According to the components of ILO Social Security bracket Minimum Standards Convention 1952 bracket number 102 Article 32, the following contingencies are covered by the Employment Injury Benefit: an accident at work or work-related diseases including sickness, temporary incapacity for work resulting from such a condition, which is likely to be permanent, and the loss of support suffered by dependents because of the breadwinner's death. Furthermore, the range of benefits mandated by Convention number 102 includes necessary medical care, sickness benefit for the period of incapacity for work, disability pension in the event of loss of earning capacity, and survivor's pension in the event of the death of a breadwinner. Such in occupational safety health, those included are employment injury scheme. Compensation and prevention are inextricably linked, both logically and practically. The most obvious way to reduce the cost of occupational injuries and diseases is to reduce their occurrence. The collection and analysis of data on occupational accidents and disease is critical for the effective implementation of preventive strategies. In this regard, the reporting system can be supplemented by sharing broader data on occupational accidents and diseases, as well as compensation among relevant institutions. One thing to remember that any workers having such two job-related injury, they are eligible for a cash benefits for temporary incapacity. It explains that most employment injury social security systems pay cash benefits to injured workers until they return to work or have reached maximum medical recovery. Temporary incapacity also includes absence from work due to rehabilitation programs designed to minimize permanent loss of earning capacity. In addition, workers also qualify to receive medical expenses and rehabilitation benefits. This can be provided under workers' compensation legislation or through general programs that are not limited to work injuries and diseases. In most cases, the injured worker is entitled to the medical care required for a full recovery. The rehabilitation benefits cover the cost of the services required to return workers to their jobs and daily life. Hence, in the case of Tahir, he is more than qualified for the following conditions, whereas to gain the medical expenses and rehabilitation benefits. It is said then because he gains the injury and incapability because of his working conditions that require him to standing and bend regularly over a long period. There is one more thing can support this argument, which is not only him suffer the following health conditions, but for his other 9 colleagues experiencing the same health issue. To be concluded, that is how Tahir are qualified the stated condition for him to get the medical benefits under the components of Employment Social Security, ILO. That's all from me, thank you.
Hi, Assalamualaikum. My name is Izzatul Aimiti Muhammad. The question that I need to answer is explain briefly the 6 type of return to work hierarchy that may be related in Tahir case. The Return to Work RTW program is a rehabilitation program offered as one of Socso benefit to ensure person who had been injured or diagnosed with a disease. There are 6 types of return to work hierarchy that may be related in Tahir case, and the first type are the same job, same employer. In this situation, after the recovery, Tahi can work as a vehicle spare part production operator at the same automotive company. He was able to work as usual after joining this program and recovering from his pain. The second type of return to work hierarchy is a similar job, same employer. Tahi still can work at the same automotive company in Selangor after the recovery. He maybe get a similar job as before but not working as a vehicle spare part production operator like before. Next, the different job, the same employer is the third types of RTW hierarchy. Tahi able to work at the same company as before, but due to his condition, he may not be able to work as a vehicle spare part production operator anymore. He may get another job from the same automotive company that does not use more energy on his pain. The fourth type of return to work hierarchy are the same job, different employer. Tahi may not work back at the same automotive company as before. If Tahi is success recovering from his back pain, and if he really loves his old job, he can get the same scope of work as before at other company. The second last type of this hierarchy are different job, different employer. Due to Tahi condition, with a slip disc, he would not be able to perform a variety of job tasks. He should work at another place with different job scope that not requires carrying or lifting heavy things. The last types of the return to work hierarchy are self-employed. Tahi can start a new business that's suitable for her healthy condition. This is the best Tahi to choose because he is not bound with any work or company. That's all from me. Thank you.